And, but in the
Okay, based
meantime,
on
they
the
could be
results.
shutting the door on some of those abuses. And the other one is you see an awful lot of imaging studies being ordered specifically just to avoid lawsuits.
Yeah.
And
Yeah.
I don't know how people could just stop that. I mean, those two things right there would, even though they're only temporary, would really change the amount of money that would be going out the door.
Yeah,
While you're
I
trying
think
to implement the other processes.
I think those are all good points. I think that they all go back to, though, the root cause of the problem here is that we're not paying for what we want. We're paying for more imaging procedures at a high margin rather than paying for the better results for patients who are getting the imaging procedures that would help doctors do what they'd like to do, which is, I think, deliver care more efficiently and only do the imaging where it's really going to be helpful. It's just hard to do that under our current financing rules. And I think this, more attention to outcomes and doing a better job of confidently saying, okay, this is the best treatment for you, and people like you who are treated this way have better results. That's got to help with the liability pressures too. I mean, right now, a lot of the lawsuits are driven by bad outcomes that may or may not be related causally to the treatment that was provided. If we did a better job of connecting the treatments with the results, then it seems like there'd be less pressure on physicians there as well. Yeah.
Thank you. I just have a quick question. I enjoyed the direction that you took your discussion tonight. It's a fresh discussion to hear. My question is, coming from a family that has a physician in it, what can physicians do to help? Because right now, my mom's looking at just discharging all of her Medicare patients and not seeing them anymore. And that's a painful thing for her to do because they're her favorite patients. Is there something she can do to help the process move forward?
Yeah, I think there absolutely is, and we've got to have a better answer for physicians like dedicated physicians like your mother than just hang in there and we'll get around to this sometime. It's you just can't. You're getting to the point where these physicians can't even make ends meet. One of the things that I've noticed over the last few years is that the organized medicine groups, and I'm not sure if you mind my asking, what specialty is she in? Family practice. So the family practice doctors have been, in the last few years, completely out front on reforms in our payment systems and coverage systems along the lines that I've been talking about. The American Academy of Family Physicians has developed a proposal called the medical home concept, where instead of having internists paid based on all the lab tests and imaging, and getting paid more when they buy a CT scan for their office and start scanning all their patients, give them a payment for coordinating the overall care for the patients that they're primarily responsible for, and then give them additional payments if they're able to achieve improvements in coordination of care, the results for those patients, or